Here in Grenada, the statistic says about 10 to 15% of the population has diabetes. Recently, of those who were admitted regarding ulcers in the feet, etc., there were 52% of them had amputation. That's a high number.
That was Dr. Dwight Matthias speaking at a public lecture organized by the Cathedral Men in the Footsteps of Christ. Dr. Matthias is a Grenadian-born endocrinologist who returns to Grenada twice a year to perform clinics in collaboration with the Ministry of Health and the St. George's University.
Throughout the years, they have worked together to bring specialists onto the island to assist with some of the complications of disease. As you know, our physician population here is mostly general practitioners, and if there are complications that goes beyond their capability, they need a specialty care.
In the Caribbean, diabetes is known as a silent killer. In an effort to educate the nation on its myths and facts, the screening and lecture was held.
In the screening, it goes from let's say 40 to 100. In my clinic, as I'm a one-man show with a nurse, I will see over 50, 70 patients in a day. In my span of a week, I may see close to 200 patients during that span of time. And it's exhausted, but at least it really brings me to a point to do no harm, to extend a helping hand where possible.
Many questions were raised during the lecture.
I would drink just basic water and I would have a salad. But then if I use salad dressing, there is something within the dressing that would automatically shoot my sugar up.
So sometimes you may say, I'm not eating, I'm not doing anything, and the sugar is high. Remember I specifically said, sugar comes from two sources, what you eat and what the liver makes, right? So it would be great. What is his blood sugar before that water and salad with salad dressing? What is his sugar there? What is his sugar 2 hours later, right? So yes, the salad dressing is playing a role. But I think that the sugar is also coming from his liver.
The 10-year-old program has benefited many over the years.
Throughout the years, the desire or the willingness of folks to come out in the community, from the community to determine if they have diabetes and hypertension. And it has been a very successful project for the past 10 years.
Due to the large turnout and follow-ups needed, the Cathedral Men in the Footsteps of Christ will endeavor to continue this project. Mr. Lawrence Duncan explains.
I think people are not paying attention as they should to their health. And we had it on our program this year to look at health, especially men's health. And coming out of discussions I had with Dr. Matthias yesterday, we would be doing ongoing programs for men's health.
Organizers dubbed the first phase as successful. The second phase is scheduled for November.